Hello, my name is George. I'm here again to do a video as my patient. And then today, what we're going to cover is lungs, heart, vessels, uh, and chest. So, first, basically, we would ask the patient its history. So, I would go and say, do you have any history or family problems that with pertain to lung or heart condition? Or peripheral vascular disease or anything like that that you can tell me about?
Yes, my mother has heart problems, and that's about it. Only my mom.
What kind of heart problems?
Um, she has cardiac insufficiency.
Okay. Does she have a history of heart attacks?
Yes, she does.
She has a history. How many heart attacks has she?
Two.
Two. Okay. And your father?
No.
Any?
Cardiovascular, no. No
Okay.
problems with that.
Okay. Do you have any history of cardiovascular problems?
No.
No. All right. So this would be subjective data that would be collecting like the history of the patient or things like that. Any problems with smoking or in the past? Have you ever smoked before, or
No.
any recreational drugs that you've
No.
done in the past? Okay, so we would basically it's like my blood pressure monitor. So we're gonna take her blood pressure. So here would be collecting objective data. Just put it over your chest and just hold still. Try to not move, please.
Sorry.
Okay. So her blood pressure is 108 over 82, so that's fine. And her pulse is 68, so that's fine. So we would also do teaching, education. So basically, the blood pressure 108 over 82 is within normal limits. We're trying to, our goal would be 120 over 80, so it's not far apart. Once you're the top number, which is the systolic number, which is the top number of picture like a fraction, would be under 100, then we would be referring them to the doctor. If would be over 150, we would refer them to the doctor. And then the diastolic, well, as long as it's 80, between maybe 70 and 90, then that would be our goal here. The pulse is 68, so that's also within normal limits. Our goal is to be 60 through 100. If it was below 60 or above 100, then we would refer them to the doctor. Usually, like if the pulse would be below 60, we would ask him if you're an athlete or things like that. Usually, athletes tend to have a pulse that's below 60, and that's fine. Okay, so we would continue and we would look at problems with the lungs. As you can see right here, she's let me just put her a little bit to check her lungs. You can see that she's breathing properly. She's not having any shortness of breath, difficulty breathing, orthopnea, paroxysmal nocturnal dyspnea, which would be 10 at night when she would be asleep. I would ask her, do you have any chest pains right now?
No.
Chest
No.
pain would be another one. And then right now, well, when I check her lungs, we would be checking for bronchial breath sounds, which is normal. We would be checking for wheezing, dyspnea, or cough, mucus, rhonchi, things like that, congestion. Right now, I have my stethoscope, so I'll assess it right now. So I already went through the history. So she's alert oriented times 3, so she's mentally stable. So right now I would ask her, we would inspect the color, symmetry, chest expansion, type of breathing, labored muscle retractions. As you can see, it's symmetrical, meaning that when she's breathing, both chests on both sides are rising at the same time, not rising higher than the left or anything like that. basically checking for symmetry. Labored breathing muscle retractions, meaning that she would be basically using her chest muscles here, and she wouldn't be breathing properly like a regular person. So also, we would palpate for tenderness or lesions, but like I said, she's mentally stable, so I could just ask her, do you have any bruising? Do you have any laceration, abrasions, anything in your chest
No.
area? Do you feel any tenderness at
No.
all? Everything's okay?
Everything's fine.
Okay. All right, so what else? So another thing that I was looking through the PowerPoints is we would check for fremitus. So it's a vibration. So basically, there's different ways. There's a lot of ways, but basically I would put my hands right here on top, like this, and like this, and then on the sides, and I would just ask her to say 99. So that's the way to check for fremitus. We're checking the vibration to see that everything's fine. Within that sort, or if the vibration is not correct, then maybe she has congestion or anything like that. So what else? The back. So you can just turn real quick, put your hair back. So here the back, we would check for tenderness, pain, unusual sensations. We can also continue assessing for fremitus. So as you can see right here, any pain?
No.
So right now as I'm palpating, there's no tenderness. So and also right now with my stethoscope, I'll check for breath sounds. There's 10 points in the front for the chest that we can check for the breath sounds, and there's basically almost 20 points in the back where we could check for the breath sounds. So I'll do that right now. Yeah, okay, so before moving forward, let me auscultate the breath sounds. So we'll start with the back. Okay, so here, what we're gonna do is check the breath sounds. Is that we're gonna be in between the scapula, which is right here in the middle, and I would just ask her to breathe in and out. Okay, so just breathe deeply. Again. 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 Okay, so I'm just gonna check 4 points. I mean, there's 20 of them, but they're basically just going down the back. And I check in, they're fine. Like I said, there's no wheezing, no crackles, anything like that that we have to be worried about, no congestion. She's healthy. So here in the chest area also, it would be, let me see, it would be here in the middle. So we would check right here, starting right here. Breathe in, breathe out, right here, and then in the middle of the chest area, right here. So I already checked the back and everything was fine. All right. So we were also going to check for the vessels. So we can start in the neck area. The carotid artery and the jugular vein, basically they're right here on the side. You can just turn that way, your head turn that way. So here we would check the jugular vein. We would check for jugular distension. One way of checking it is that to lay them flat on a bed and then just raise the header. Unfortunately, we don't really have that type of type of bed here. And basically, as we're elevating the head of the bed, we're checking for jugular distension right here on this side. So also the carotid artery, we're checking for bruits, murmurs, thrills, anything abnormal. We're checking for the strength of the pulse. We can either palpate it, and then it says to not palpate too hard because you don't want to include it either. What else? So we can auscultate it as well with using the bell of the stethoscope, which would be this part right here, the bell, and then this would be the diaphragm. So we would check it with the bell like this. Let me see what else. Okay, so here we'll just move into the vessels of the heart. We'll go back to asking any family history with heart problems. We already covered that. Any cholesterol?
Yes, both my parents have cholesterol.
High cholesterol.
Mm-hmm.
Do you have history of high cholesterol?
No.
So with cholesterol, we would try to educate them, and it just goes back to minimizing heart problems. It goes just back to simple things: diet, exercise, things like that. We try to educate the patient, and being the cholesterol being less than 200, the total cholesterol being less than 200. Um, if it's higher than 250, that would be critical. Other things like high density cholesterol. Um, and low density cholesterol. The high density has to be, that's the only one that we want to be above 50 because those are considered the good type of cholesterol. Low density, we would want to keep it below also. High is the only one that we want to keep it above 50. Other than that, just going back to exercise, diet, eat healthy foods, going back to vegetables, um, fish, steamed, nothing fried, fruits, things like that. Just keeping it healthy. We would ask the patient what we usually eat for like daily, like a normal day. What would you eat? Like breakfast, lunch, dinner?
Oatmeal in the mornings, and then during lunch, maybe some chicken, and then for dinner, something like cornflakes,
Okay.
something light.
Okay, that's very healthy.
I try.
Yeah, that's very healthy. That's a good point. So things like they already checked the blood pressure, the pulse, that was normal, so we can continue from there. Going back to the heart, it's right here in the central area. It's protected by our sternum, and the main arterial great vessels would be like the aortic, the pulmonary artery. The venous great vessels would be the superior vena cava, inferior vena cava, and the pulmonary vein. So problems with heart going back is any chest pain, edema. So the edema with heart problems, we would check on the lower extremities. So I would check it. Right now, I'm just looking at her legs; they're fine. We try to like basically push in, and if we see like the skin going down, I mean that's basically telling you that, or making like a pocket on your leg. That's basically telling us that it's edemias. Um, Dyspnea, any shortness of breath, sweating, diaphoresis, fatigue. Fatigue would be a big issue if you're just basically like getting up from the chair and walking to the other side of your house where the restroom is, and you're fatigued, then that's a big problem. Palpitations, anything like that. So basically, just having palpitations where and having chest pain and things like that, or you feel that your heart's overworking, and we would refer them to the doctor. So that would be it. So basically, the apical pulse is basically the main point where or the mitral area where we would check for the heartbeat. It would be in the fifth intercostal space, mid clavicular. So this would be right here on my left side, and then in the middle it would go down 1, 2, 3, 4, 5, and it would be like under the breast region. Be under the breast region right here on the side. That would we would check it. Sometimes what we can do is if we're having problems hearing it, we can just lay them on the bed on the left side, and then we could check it with our stethoscope. Other traditional points where we can auscultate the pulse would be the aortic, which is on the right side of the sternum. And then we would go to the pulmonic, which is on the left side of the sternum, and then tricuspid would be a little bit below that. Erb's point, below that one, and then the mitral area would be like on the fifth intercostal space, midclavicular, under the breast. We would check for murmurs for the S1, S2 beat. We would check with the diaphragm and the bell of the stethoscope. Breathe normally. While I'm checking it, just to breathe normally. So right here, I'll just check the aortic one. I'll check the pulse. So be on the side. Can you hear it? Okay, so it would be right here on the right side. So the beat's fine. It's regular. It's normal. It's not skipping a beat. It's no murmurs or anything like that. We tell them to breathe normally because usually when we're checking for lung sounds, that's when we tell them to inhale deep, and then exhale. But for the beats, we can just tell them to breathe normally. And also, like I said, the diaphragm, we can check it with the diaphragm or the bell as well. Okay. What else? What else? Okay, so I guess that would be a quick assessment of the lungs and the heart. Now we can go into the peripheral vascular system. It's important because it circulates oxygen and nutrients throughout the body, consistent of the arterial and the venous system. Venous collecting the oxygen and returning it to the heart, and then the arterial delivers oxygen from the heart, which is pre-oxygenated to the rest of the body. And also the lymphatic system, it drains excess lymph fluid from bodily tissues and returns it to the venous system. It also assists the immune system with fighting infection. So here are the problems with the veins. We would basically check their extremities. So just right here, or just tell them to lift it up right here. We would check. So basically like how we're checking for edema, if I'm pushing my fingers in and it creates a pocket, like it takes a while for the skin to go back to the same level, the baseline of the level, then that would be edemas. But other than that, we're checking everything's fine. We can check the brachial pulse times 2 to compare it to check if the pulse is strong, beating regular and effectively. So that's what I'm doing right now. I'm palpating it, and I feel it is strong. It's fine, no problems. We check the radial. We're checking times 2. So we're checking the radial right now. It's fine, same. And then here, unfortunately, you can see there's no way of checking the capillary refill. What we would do is basically push it in, right? But what we can do is actually like turn it, and we can use the fingers. So what I'm doing is right now it's pink, so I'm gonna push it down, and it blanches, and then we're gonna basically count the seconds for it to go back to the regular pink normal skin color. Less than a second, so that's fine. So what are we checking when we're doing that? We're checking indications of good cardiac output and peripheral circulation. So if it's above 3, then that means that's a problem. We need to document it, call a doctor. So that's what we're doing here when we're checking the extremities. Let's see what else. Any pain?
No.
So basically the pain is very important to actually document it correctly. We have to check the onset of the pain. We have to check the duration, the frequency, things like that. We have to ask them on a pain scale from 0 to 10, 10 being the most painful. But she already said no pain, so we don't have to go into detail with that. But that's what basically we would be looking at with pain. Any numbness or tingling on your fingers or anything like that?
No.
No, okay. Any cramping?
No.
Right now, no. Skin changes, edema, decreased functional ability, everything's fine. Okay. Also, one thing I forgot to mention is symmetry. So we have to check symmetry. So we would tell them to maybe go like this, like that. We're checking for symmetry. We're checking any redness on this side, or going back to any swelling, arrhythmia, things like that. But right now I already checked it. It was fine. Okay, what else? Another thing would be temperature. To touch, usually the one that's very, very common, I work at a nursing home, and it's very common there after a total knee replacement. Usually they go for rehab there at my nursing home. And sometimes where they have the total knee replacement, sometimes on that leg it gets really swollen on the bottom of the calf area, and it's very painful. And sometimes because of the surgery, any complications of the surgery, usually it creates a DVT, a deep vein thrombosis. So basically that's how we need to check for the temperature, and we need to check both legs. And but usually it's not even warm, it's extremely hot. So usually on that side of the leg it would be extremely hot, extremely painful. So we would order a venous Doppler. We would call a doctor, order the venous Doppler. If it was positive for DVT, then Sometimes we would just get an order for heparin, things like that. So that's what we were checking. That's why we're checking the temperature of the legs. Usually it's on the legs, but we can also check on the arms if anything, any issues like that. And what else? So venous stasis, we're checking for venous or arterial issues. We can check also the hair. Also, that's another thing we can check that could indicate us to an arterial problem. Um, Venous stasis, which would be the browning of the skin color. Usually it's on the bottom of the legs. So we need to inspect them from the groin to the toes of the feet to check if there's any problems, any varicose veins also. That's issues with the valves in the veins that are not they're not functioning properly. What else? Ulcers to the legs also could a part of peripheral vascular disease. So we're also checking the pulses, also the femoral pulse. So the femoral pulse would be like maybe the groin, and then the femoral, and then the popliteal being under the knee on the other side, posteriorly of the leg. We would do the dorsalis pedis, which is on the foot, which is on the front, and then the posterior pulse, which would be like on the side, maybe like on the ankle area. So we're also checking times two. So we're checking if the right and left are at the same pulse, same rhythm, strength of the pulse, that everything's fine. Also the symmetry of the legs. That's also what we're checking. I'm just making sure I covered everything. Okay, that's pretty much it. Like I said here with the lower legs, we would just basically inspect them. That's the number one thing, and then from there we just do we touch for the temperature. We ask them for any pain, but as you can see, she already said she has no pain. Have you had any? Going back a little bit to the history, have you had any problems with peripheral vascular disease or anything like that?
No.
Any changes in color of your lower extremities?
No.
Any changes with sometimes with the varicose veins, you can see that they're blue and they're like squiggly, they're all over the place. Have you had any problems with that? Okay.
None whatsoever.
Okay, so just going back to a little bit, checking everything, the subjective data. And that's pretty much it. I think I covered mostly everything. Mm-hmm. Okay, so that would be it. Going back, we did an assessment on the heart, the lung sounds, the vessels, and that's what our main topic was for today. So thank you very much.